Welcome, friends. This is Doug Schmidt, and welcome to the Professional Boundaries for Chiropractors presentation, sponsored by the Schmidt Law Firm. I would ask that you note that the approval number by the Chiropractic Board is number 58177. And I'm going to ask that you note in your notes someplace and keep track of this, that the magic number for the seminar, magic word for the seminar is subluxation. And if anybody should question whether you were present and participating, you will be able to reveal the magic word subluxation. And we're going to give you a magic word at the end as well. So again, welcome. Hold on one second. So, okay, how do I move to this? I am learning to use this system. Okay. Here we are at the professional boundaries. The index is listed here. The things we're going to be talking about today are with primary emphasis on the scope of practice, the new statutory changes, definitions of chiropractic, definition of abnormal articulation, which you all know, you all learned in your chiropractic college, but it's important for us to take a look at the statutory definition of it as well. Chiropractic services include diagnostic services, therapeutic services, acupuncture, animal chiropractic services. We're going to be talking about the duty to refer and basically those conditions that fall within the scope of chiropractic practice, as well as those that have a duty on your part to refer and or to co-manage with other healthcare professionals, whether they be MDs or otherwise. Grounds for revocation of your licenses, conditions often missed, record-keeping duties, concussion injuries, headaches, disability as it relates to the scope of your practice, letters of protection and liens, advertising rules. I just want you all, again, to know how much I appreciate chiropractic. 80% of the cases that the Schmidt Law Firm represents are car accident, motor vehicle, trucking accidents, bus accidents, motorcycle accidents, and 80% of those are actively treated by chiropractors. I've personally been a patient of chiropractic since I was in middle school. I have my father's best man at his wedding was one of the earlier chiropractors out of Palmer in Davenport. I love you all, even though you have manipulative personalities, because you all make adjustments for the problem. Ha ha. I've been doing this for 40 years, and I have been blessed in the last 10 years to have been asked to give continuing education seminars, presentations, various places, Doctor's Lodge, spinal imaging over in St. Paul. I've even lectured at Northwest Chiropractic. Many of you know my good friend, Dr. John Wolf, who was my law clerk when he was going to law school. And I remember even Dr. John Wolf Sr., knew him well, who founded Northwest Chiropractic. So we love chiropractors. I feel that I know the discipline well. I enjoy teasing my fellow lawyers who are personal injury lawyers, asking them questions like, what's George's line? And their eyes glaze over. My favorite one is, tell me the difference, tell me whether the intervertebral disc between C1, C2 is larger or smaller than the one at C5, 6. And most of them are puzzled. They just don't even have basic understanding of basic chiropractic principles. So here we go. The statute says that chiropractors have a duty to limit their practice to the practice of chiropractic. Well, that's double talk. So what is the practice of chiropractic? And the statute, the legislature has told us that it includes, I've underlined, chiropractic services, acupuncture, therapeutic services, including the diagnosis and the rendering of opinions, and the provision of a treatment plan, appropriate referral, and we're going to be talking about that in more detail, appropriate referral, the duty to refer, or both. And of course, the standard exclusion is that chiropractic is not the practice of medicine, surgery, osteopathy, or physical therapy. Now, that distinction between chiropractic and physical therapy can be a blurry one, too, which we may be talking about a little bit more in the future today. The new statute states that chiropractic means a healthcare discipline that recognizes the innate recuperative power of the body to heal itself without the use of drugs or surgery. And there is the language that distinguishes you from the medical community. But doing it by identifying and caring for vertebral subluxations and other abnormal articulations, and by emphasizing the relationship between the structure and function, get this, as coordinated by the nervous system and how that relationship affects the preservation and restoration of health. Later on, I will be telling you, discussing a little more detail, that the statutory scheme in Minnesota, basically the general rule is that your practice needs to primarily focus on the classic chiropractic manipulation and adjustment, and those other things that you do within the scope of that practice that are secondary to that are totally acceptable. Those that are questionable, such as problems with hypertension, problems with gastro problems, diabetes, and so forth, probably require by law co-management with the medical community or complete referral without continued co-management. But chiropractic services under our state law means the evaluation and facilitation of structural, biomechanic, and neurological functions and integrity through the use of adjustment. And there you go, through the use of adjustment, manipulation, mobilization, or other procedures accomplished by manual and mechanical forces applied to the bones and the joints and the related soft tissue. That would be the muscles, the ligaments, the tendons, and so forth, for correction of vertebral subluxation, abnormal articulations, here you go, neurological disturbances, structural alterations, mechanical alterations. It's not limited to, includes but not limited to manual therapy and mechanical therapy. This is just a review. A lot of you know this. We may be, and likely, are covering something that you know all well and good, but there's a reason that you have continuing education to remind and review those things that you know well. The definition of abnormal articulation, you know that. You know that. Take a look at it. It's something you know very well. You work with that every day. So the diagnostic services and diagnosis is also defined to mean the clinical, physical, clinical, laboratory exam, and to include for the purpose down here under Section 5 to determine the presence or absence of a condition, deficiency, abnormality, deformity, or disease as the basis of evaluation of a health concern. I want to stop there. Let's think about that for a little bit. My cousin, who's now in her late 60s, was born as the daughter of a dental student at the University of Iowa way back about 1950. With the worst case of infantile colic imaginable, she was a whining baby times 10. And she stumped and puzzled all of the pediatric specialists at the University of Iowa Department of Pediatrics. Folks, who do you suppose solved the problem? Chiropractic manipulation. It could be argued that it just happened that she got over it on her own just about the time she was getting chiropractic manipulation treatment, or whether the chiropractic was the solution to the problem. And I vote for the latter. I remember back in the early days of my practice, in the 1970s, I was practicing out in Worthington, Minnesota, small town of about 12,000, 13,000 people. I remember being at the dinner table with a medical doctor, a surgeon, general surgeon, who was complaining about chiropractic. And I looked at him and I said, "Doctor, the way I see it, I've only been here in this town for about 5 years and don't have a whole lot of experience with chiropractic and in the personal injury business, but it seems to me that every time a chiropractor does the right thing and sends the patient down to you, acknowledges the duty of referral, that they get a lecture from your doctors, your medical doctors at the clinic, that you ought not be treating at all with chiropractic, and chiropractic is a bunch of witch doctory." And I said, "I hear you complain about the fact that rural America needs more doctors. At the same time, you're doing everything imaginable to create a total schism between the medical community and the chiropractic community instead of working together as a unified part of the total health care system." And in the 40 years that I've practiced personal injury, I've seen a wonderful change. It all started pretty much with as I see it, with the doctors, the neurologists at the Naran Clinic being willing to work with chiropractic, refer people back and recognize the continuing viability of chiropractic adjustment as a complement to the medical treatment by the neurologist. Not long ago, well, it's been quite a while ago, I was picking a jury down in Dodge County, the next county over from Mayo Clinic, and lo and behold, one of the people on the jury happened to be a chiropractor that was on staff with Mayo Clinic. And I understand that the Obamacare statutes even make provisions for healthcare organizations to include the services of chiropractic specialists. You now have the specialty fields of neurology and so forth. But the general rule is the chiropractic doctor should always perform an examination necessary to identify medical conditions outside the scope of chiropractic and refer those patients in need of treatment, such as diabetes, hypertension, cancer, etc., to a medical doctor. And that is true even though the chiropractic therapy may be an important and useful complement or adjunct to conventional medical treatment. I have a note here about cauda equina. I'm going to tell you that in my professional career, I've handled 3 cases of cauda equina. And thank the Lord, they're medical malpractice cases. Thank the Lord that the healthcare provider in each of those cases that failed to pick up on the symptoms of cauda equina, the bladder, the bowel and bladder, the lower extremity symptoms, the saddle anesthesia, in each of those 3 cases was a medical doctor and not a chiropractor. I just had lunch this week with a chiropractor friend of mine who indicated that she was lucky enough that she'd never encountered cauda equina. But I'm going to tell you that 2 out of the 3 cases that I've handled have been patients that have ended up with paraplegia, permanent, serious disability due to paraplegia by MDs that failed to pick up the symptoms, the red flags for cauda equina. The third one was a beautiful young lady in her early 30s that ended up with permanent saddle anesthesia, difficulty of bowel, dysfunction of bowel and bladder, and of course the attendant sexual dysfunction as well. And I will tell you that the paraplegia cases ended up with huge settlements. So we've got the statutory definition of therapeutic services. Includes rehabilitative therapy, all the therapy, rehabilitative, preventive sciences and procedures that for which you're licensed. Now, the therapeutic services must be performed within a practice where the primary focus is the provision of chiropractic services. I've underlined and put that in gold because there is basically the general rule, the line in the sand that distinguishes the scope of chiropractic from other types of medicine. Acupuncture. I'm not going to spend a lot of time on acupuncture. You know that you have separate licensing for that. There's also, I'm sure you're aware, separate licensing for acupuncturists outside of the purview of chiropractic or medical. If you go to the Minnesota statute on acupuncture, it provides for an exception or an exemption from the acupuncture licensing for anyone who is an MD, a DO, or a DC. And then, of course, for those people, and particularly the chiropractic acupuncturists, you have your own set of rules that relate to that. We have animal chiropractic, and I'm not going to spend a lot of time with that. You have separate rules that apply to that. Obviously, the animal chiropractic practitioner is not authorized to perform surgery, dispense any drugs or medication, or perform traditional veterinary care and diagnosis. Now, what on earth does that mean? That would be a subject of its own separate discussion. The general rule is that rehabilitative services are those that are performed within the practice where the primary focus is chiropractic services. Now, we're going to get into this in a little bit. What is the duty of a chiropractor? What is the standard of care of a chiropractor to be noticing, picking up on, making a provisional or preliminary diagnosis of conditions of cancer, diabetes, Crohn's disease, MS, or whatever, and to make a referral to another healthcare provider for care within that person's, that professional's expertise. Minnesota statute references the issue of appropriate referral, but does not squarely address the issue of the duty of the chiropractic doctor to recognize a non-chiropractic. Back up a second. I would say that there are separate categories. Those conditions that can be totally managed, solely managed by a chiropractor, those that should never be managed or treated by a chiropractor, and those which should and can be co-managed by the chiropractor and the MD or other specialist. Your Code of Ethics of the American Chiropractic Association says this: doctors of chiropractic should willingly consult the talents, unseat, and seek, I think it should be, the talents of other healthcare professionals when such consultation would benefit their patients and when the patients express a desire for such consultation. Think about that for a minute. I think that code is saying that when your patient asks you for a consultation, you have no choice ethically but to make that referral. Goes on to say that the doctors of chiropractic should cooperate with other healthcare professionals to protect and enhance the health of the public. I am going to show you this chart. The chart's up, that comes from one of the major malpractice insurance companies that sell malpractice insurance to chiropractors. And this report indicates that chiropractors are diagnosing the following conditions: spinal subluxation, joint dysfunction, hyperlordosis, hypolordosis, extremity subluxation and joint dysfunction. So that involves hands, wrists, knees, ankles, other joints than just the joints of the spinal column. Kyphosis, sprains of any joint, headaches, cervicogenic headaches in particular, myofasciitis, muscle strains, radiculitis, radiculopathy, intervertebral disc injuries, tendinopathy, carpal or tarsal tunnel syndrome, TMJ, bursitis, synovitis, degenerative joint disease, structural scoliosis. Here we go: rheumatoid and inflammatory arthritis, osteoporosis, asthma, emphysema, chronic obstructive pulmonary disease, pregnancy-related conditions. That's an interesting topic there. I presume we're talking, obviously, about stresses and conditions of the spine related to particularly the lumbar spine, related to the pregnancy, and what else? Fibromyalgia, concussion and head injuries, 70% of the cases, ALS, MS, Parkinson's disease, hypertension, hypotension, diabetes, spinal stenosis. I'm not sure, spinal I think I need to do a little correction to that slide. Now we're talking about conditions co-managed. The first one was conditions diagnosed by the chiropractors. Now we're on conditions that are co-managed with other healthcare providers. And I'll let you scan down through this. You'll see, you can see these conditions. I don't need to just read them off for you. And I will say this, any of you that want to have me send you by email or otherwise a copy of these PowerPoints, just email the Schmidt Law Firm and we'd be happy to send those on to you for your further review by email or by hard copy U.S. mail. Menopause, vertigo, colitis, diverticulitis. I would suggest that this list seems to include those conditions that it's not optional, that the chiropractor should definitely be co-managing these conditions with other healthcare providers. I want to call your attention, hold on, let's go to the next one. Call your attention to the issue of the traumatic brain injury. This slide talks about the conditions most frequently missed or overlooked by chiropractors. And number one on the list is concussions and traumatic brain injuries. Oftentimes, I don't think headaches are overlooked in the practice, but they are so often overlooked in the diagnosis or the assessment portion of your records. I see so many cases. We're going to be talking about record keeping requirements in a little bit. So many cases where the ICD-10 code for headaches doesn't exist anywhere in a chiropractic record. Same is true with regard to myofasciitis and myofascial pain syndrome. Going back a second, though, to the headaches, to the concussions, we find at the Schmidt Law Firm that 60% of our new patients, our new clients that come in with a moderate to severe car accident have evidence of a traumatic brain injury that's been totally missed by the medical community, and more often than not, sad to say, missed by the chiropractors as well. We very seldom see facet joint injuries documented in the record keeping with the appropriate ICD-10 coding. Here's the scary part. The rules that indicate you can lose your license for any of the following. False advertising, and we're going to have a section later on talking about the 2 Minnesota statutes that apply to false advertising, fraud, practice under a false name, conviction of a crime of moral turpitude, habitual drug or alcohol usage, inability to practice with reasonable skill and safety. Now that's a pretty vague one, but that falls back again on our earlier discussion about what is the level of competence of the chiropractor to be watching out for those conditions that need to be co-managed and picking up on it. I would say with reasonable confidence that a chiropractor that misses, overlooks a case of cauda equina where the red flags are out there and it's missed and not referred, sent along for medical treatment, is a target for a medical or chiropractic malpractice lawsuit. No question about it, I'm caught acquainted. I think it gets to be a little different issue with some of the others. Years ago, I was involved in the case of a chiropractor who was doing scar release massage on a female patient following breast augmentation surgery. And that was a very close question. It was a very close question. I enlisted the services of a female chiropractor, head of owner of a relatively large clinic, who testified that she would have no problem whatsoever with one of her male chiropractic employees doing that kind of therapy or treatment, of course, under controlled circumstances, and would include very careful instruction, information, and perhaps even the presence of a female staff person. But at any rate, number 8, revealing privileged patient information. And we are now in the age of Facebook and social media, and that becomes an even more pressing problem about client confidentiality. And I will say this, it probably is an ethical violation, even a statutory violation, to even send a message by Facebook or social media indicating the existence of a doctor-patient relationship. Let me say it a different way. The mere mention by you as a doctor of chiropractic that somebody else that you're communicating with on social media is your patient, in and of itself, may be considered a violation of doctor-patient confidentiality. Number 9, failing to keep written chiropractic records justifying the course of treatment. Exploitation of a patient for financial gain, delegating professional responsibilities to an unqualified person, and unprofessional conduct is defined as including gross ignorance or incompetence. Now, that's probably your protection, your professional protection against a claim that you failed to pick up on Crohn's disease or some medical condition, that the statute's cutting you some slack, that it takes a gross ignorance or incompetence. Now, whether the professional misconduct as defined by the statute standard would apply to a chiropractic malpractice claim remains to be seen. We have the sexual problems, sexual conduct, performing unnecessary services, charging an unconscionable fee for services not rendered, dishonest and misleading fee collection practices, Medicare, Medicaid, medical assistance fraud, advertising to accept a payment in full, giving the impression of eliminating the need for payment of a deductible. Let's stop there for a second. I have encountered the circumstance fairly frequently where my clients tell me that the chiropractic doctor has told them, where there's a lawsuit involved, that they will go ahead and treat with the understanding that they will be reasonable, and they'll run up the bill with the idea that they'll make a reasonable reduction depending on the size of the personal injury settlement. And that is a problematic, it's a problem. Record keeping. I am going to tell you that I have been handling no-fault arbitration cases for 40 years. I was around back in 1975 when the Minnesota no-fault law was first passed. There have been years when I have gone to 50 or 60 no-fault arbitrations a year on behalf of my clients. And I'm going to tell you that I hear the argument from the defense lawyers time and time and time again that the chiropractic doctors' records are substandard, are in violation of the Minnesota chiropractic record-keeping rule, and then they argue if the records are bad, if the records are illegal, then you shouldn't award, the chiropractor is not entitled to repayment of the bill. Or a little different spin on it is if the records are bad, then the diagnosis is bad. And so I'm often in these no-fault arbitrations defending the record keeping, and I'm going to tell you, there are very few chiropractic records that I look at, and I'm going to interrupt myself. I look at more chiropractic records than any of you chiropractors that are attending, because I've got 150 cases, 80% of which are receiving chiropractic treatment, and so I'm seeing dozens and dozens and dozens of chiropractic records. I'm reviewing them to get ready for court, for arbitration. I'm defending the records in arbitration. And I see very few records that I would get 100% grade in a course on record keeping that are in total compliance with the statute. Description of past conditions, the records that are required, description of past conditions and trauma. What past conditions? Only chiropractic? Or does it require a general review of the patient's total health history going back to childhood? That's an interesting question. Past treatment received. Are we talking about only past chiropractic treatment? Are we talking about past treatment, medical, chiropractic, or otherwise, only as it relates to chiropractic conditions, or the whole body? I think that the whole body interpretation would be overly broad. Current treatment being received from other healthcare providers, current treatment, and I think this is chiropractic, including the onset and description of the trauma occurred. Examinations performed. All your examinations. I see chiropractic records that don't list the range of motion. Most of them do, but some don't. I see many that do not document the muscle groups, back up a sec, that don't document myofascial trigger points at all, and some of them that, even though they mention myofascial trigger points, don't document the muscle groups, how many of them there were, and what the muscle territory area was. Diagnosis supported by documented objective and subjective findings. I'm seeing case after case where the clients come into my office. My staff does an evaluation for a traumatic brain injury or concussion. We use the Rivermead screening tool questionnaire that lists we'll be talking about that in a little bit. And I go to the chiropractic record, and the concussion or traumatic brain injury is nowhere to be found. As I mentioned earlier, the headaches are nowhere to be found. There are ICD codes for myofasciitis, for ligamentous laxity, for chronic pain. I love to see a chiropractic record that, in a typical whiplash case, that has 8 or 10 or 12 different appropriate diagnostic codes. Anytime you are listing in your assessment part of your records neck, cervical, thoracic, and lumbar sprain, strain, injury, and nothing else, you're sending a red flag to the insurance company that this is really only a run-of-the-mill mild whiplash case, because you're only listing it as a sprain strain, and one that doesn't, therefore, as a result, require any ongoing long-term treatment. So, to protect yourself, to protect your bill, you want to be including as many of the ICD-10 codes as possible. And remember this: the ICD-10 coding has there's a requirement of the type of trauma it was that resulted in the injury, and it's so specific that it includes whether a code for whether the patient was a driver or a passenger, whether they were a passenger in a SUV, a car otherwise, whether they were hit by a truck, an SUV or whatever. I'm just not seeing that trauma diagnosis very often in the chiropractic records. So it requires a documentation of subjective and objective findings. That includes pain. I love to see an Oswestry pain evaluation. It's really easy for you to have the Oswestry neck disability or low back disability form, or for that matter, the Rivermead, in your file, and have the patient sit in the waiting room and complete that form and make it a part of the record. The form should be part of the record. Then number 4, a treatment plan that describes the procedures and treatment for the conditions identified, frequency, etc. Daily notes with any change, listing the procedures done each visit, the description by the chiropractor of any incident that might aggravate or accelerate the condition, the results of re-examinations, when symbols or abbreviations are used, you need a key. Documentation of the family history has been evaluated. Family history. I hardly ever see a family history. Quite frankly, I think that the statutory requirement of a family history is really overdone, and it's not appropriate, but that's the statute that we're working with right now. So, as indicated, by way of summary, a complete assessment of diagnosis using proper ICD codes is required. As I indicated, often the medical and the patient and family history is ignored. You need to document range of motion, muscle spasm, trigger points with muscular location. I see as a problem that many conditions that should be documented are omitted. Catch-all sprain strain diagnosis is just a red flag to the insurance company. Head injuries, concussions, abrasions, seatbelt trauma are very frequently missed. The typical whiplash injury should include all of the following. This is not intended to be a complete and all-inclusive list, but here are some of the ICD-10 code categories that can be used in the typical sprain strain injury. The note with regard to findings of a compression fracture or disc herniation. One thing I want to say to you is, this is just an aside, but there's good and sufficient medical literature indicating that a Schmorl's node that shows up on an MRI can be traumatically related. I see the IME doctors saying Schmorl's nodes are always congenital and never have anything to do with an accident or a trauma, and they're wrong. They're flat out wrong. So, pre-existing degeneration should be noted. Now, in long-term treatment and chronicity cases, I'm seeing that chiropractors they do the initial acute assessment and list the conditions and the ICD-10 code, but they don't go on and change it when the condition changes from acute to chronic, and that is something that's definitely required. So, again, so many chiropractors and even more MDs ignore concussion injuries. And a proper history is absolutely necessary to rule in or rule out a concussion injury. I'm going to tell you that of the I indicated earlier, 60% of my new clients on car accidents have evidence using the Rivermead of a concussion injury. And I'm going to tell you, doggone near 80% of those have not been diagnosed in the emergency room or urgent care. It's just terrible. And there's a number of reasons for that. 2 weeks ago, is it 2 or 3 weeks ago, the Minnesota Gopher quarterback, Mitch Leidner, had a concussion in the third quarter of the Minnesota football game, and he was able to continue playing that game, call signals, throw passes, and was not diagnosed with a concussion that kept him out of 2 games after that, until 2 days after he suffered the concussion. There is, in fact, a delayed onset. The reasons that the MDs in the urgent care and emergency department don't pick up on are manyfold. Number one, many times the patient will have physical injuries that overwhelm the traumatic brain injury, so that the focus is on those physical injuries and the concussion or traumatic brain injury is ignored. Number two, oftentimes the symptoms of shock can be confused as with a concussion, or conversely, that a concussion can be overlooked by simply assuming that it's part of the shock condition. Thirdly, there's a delayed onset that Mayo Clinic says that the symptoms of a concussion injury progressively develop over 7 to 10 days in the acute phase, and there's good and sufficient medical literature saying that the progressive development of a traumatic brain injury can occur over weeks, months, or even years with delayed onset. So take a look at the diagnostic codes that we have here. These are all symptoms that are listed on the concussion questionnaire, the Rivermead Concussion Questionnaire. And that, again, can be used as your screening. So the question here that we're dealing with now is, are concussion injuries within the scope of chiropractic practice that should not be ignored by chiropractors? And the answer to that is absolutely. You can do better than the MDs. I think as a group, the chiropractic profession is already better than the MDs in picking up concussions and traumatic brain injuries. The symptoms of a concussion can often be confused with whiplash. It's very well documented in the medical literature that there are symptoms common to a whiplash, cervical, as Foreman and Croft would say, cervical acceleration, deceleration, or CAD injury. Symptoms of a whiplash injury are, many of them, common to that of a concussion injury, including headaches, sleep disturbance or sleep difficulty, blurry vision, ringing in the ears, reduced concentration, poor memory, depression. Just remember, chronic pain is well recognized, well known to produce depression. And severe headaches also, just in and of themselves, produce visual problems, nausea, lightheadedness, dizziness, reduced cognition. Here's the Rivermead. I'm not going to spend a lot of time. If any of you don't have the Rivermead, just call my office and we'll send you a copy of it. It should be part of your toolbox and that you use in the everyday practice. I'm going to also suggest that you might request the Henry Ford Headache Disability Index as a tool that you could be using in your practice to evaluate the severity of the impairment or disability just from the headaches alone. And also, I strongly recommend that you have the Oswestry Neck Disability Index and Oswestry Low Back in your toolbox and be using that on a regular basis. So here we are. Headaches, dizziness, nausea, vomiting, noise sensitivity, sleep disturbance, fatigue, irritability, depression, frustration, forgetfulness, poor concentration, slowed thinking, blurred vision, light sensitivity, double vision, restlessness. And I'm going to add one more that's not on the Rivermead that I think should be there, and just make a note to watch for it. Tinnitus or ringing of the ears you often see with a traumatic brain injury. Here's your Headache Disability Index, the Henry Ford Headache. And there's a rating scale that you can use. I, again, strongly recommend that you use this as part of your toolbox. We're getting close to the end of the session. I'm not going to dig into the issue of assignments, letters of protection, and UCC liens. I know there are other providers, including Keith Pendleton, that are providing continuing education specifically on that subject and can make an entire unit out of it. Here's the assignments, UCC, liens, marketing practices. I told you earlier that I was going to discuss advertising and marketing practices that can get you in trouble. And again, you're not to initiate direct contact in person or by phone or electronic means with anybody who has individually who you know to have sustained a personal injury. This is in contrast to general advertising that is not targeted to somebody who already is known to be an injury victim. And again, direct contact or indirect using any third party is also not acceptable. The advertising statute, this is in the no-fault law, so it's specific to the no-fault. It places the following restrictions on all advertising literature. It must contain the word advertising, must conspicuously contain the name of the licensee, and it applies to lawyers too, and forbids the initiation of any follow-up contacts. It does not prohibit general advertising that does not target a specific injury victim. It does not prohibit contacts with friends, relatives, social contacts, or contacts that you have with a prior patient. And of course, there are specific rules that apply to claims of ability to restore vitality or virility that you should be aware of. So that takes us to the end. We are 3 minutes away from the end. I just want you to know about the Schmidt Law Firm Guarantee. First consultation with a lawyer free, no fee till you collect. We will provide personal injury services with a personal touch. And this is, last one, number 4, is specific to our firm. I don't know anybody else is doing it. We tell our clients that we will return their call within 24 hours or make a donation to their favorite charity if we don't do that. I have 2 minutes. Are there any questions? You can type into the chat box, and I'll try to answer that. I just want to remind you that a week from today, we're going to be doing another webinar generally on neck and back injuries with an emphasis. Of course, you're dealing with neck and back injuries all the time. This is an emphasis on new medical literature and research relating to some specific issues such as the facet joint injuries, treatment with injections, RFNs, and so forth. Then 2 weeks from today, we will be doing a separate presentation on traumatic brain